Welcome, Heidi, to this
Yeah.
episode. We just want to start with maybe just telling us about your business, what you do, where you're at.
Yeah. Well, hi, Rachel. Hi, Bethany. Hi, Well Core PT peeps, pregnant peeps. Yeah. So I'm Heidi Mills. I'm a certified birth doula who works here in Kansas City. I own the business Bloc Births. You can find me on Instagram or TikTok at WhataDoulaDo is kind of my public platform. I own a birth doula agency here in Kansas City. We work in a team model of care. So I have three doulas who work for me who, we swap call. One is also a nurse who does childbirth education. So I manage that schedule and then also obviously attend births as a birth doula and work with clients prenatally on childbirth education and such. Our mission of our practice is focusing on every birth. So we don't just focus on like the more holistic type of birth experiences. We tend to do a lot of hospital birth. We work with a lot of clients who have higher risk pregnancies, as well as lots that just want us to advocate for lower intervention births inside of a hospital setting. So that's kind of our bread and butter is hospital birth support and what we kind of focus on and have kind of found their niche in that area here in KC.
That's awesome. That's awesome.
Yeah.
How did you get into being a doula? How did you get into like even just like the mission of your practice?
Yeah, so unlike I think most doulas, did not get into doula care by like my own birth experiences.
Right.
I didn't have a doula for either of my births, and I did have unmedicated births in a hospital setting. But my first birth, I didn't have the money to have a doula. I was in business school at the time, and I thought it would be a great resource for me, but just like didn't have the resources to do that. And so I worked a lot with my husband, did a lot of like education on how to support me through the birth experience. And that worked really well for our first birth. And so we just did that our second birth as well. I kind of got into the role of doula just through life experience. I worked throughout college at a nonprofit that did support to low income families. So I worked a lot with pregnant women who didn't have a lot of resources in the community to help them get hooked up with like housing and insurance and stuff like that. So I kind of saw that side of the birth world before I ever had my own kids. On the other side, I also worked for obviously a more influential family because they had a nanny. I worked as a newborn nanny for them for two of their babies and worked through their one pregnancy with some of their children where they were pregnant. And it ended up being a high risk pregnancy and their child ended up having special needs. And so just seeing that firsthand, how there was so much medical support, but then a lot of people in their life had no idea what to do or how to help at all, or also just didn't have the resources or time to like give them help and support. And so it just really kind of ignited this thought process of like, wow, there's so much lacking from the medical model of care inside of our country, like so much that needs to be added on to. And so I went to school. I have a business degree with a minor in nonprofit management, and I thought I'd go the nonprofit route and start working in like a kind of a family resource center kind of environment with families. But then the pandemic hit, and I was graduated from business school with a 1-year-old in the middle, like on May 2020. So like middle of pandemic. And so, yeah, so I didn't want to stick her in daycare full time because it was kind of a stressful time to try to figure that out. Not only is it stressful to think about putting your child in like a obviously germy environment, but also you weren't even allowed to tour daycares
Oh,
or
right.
anything. Yeah. Yeah. So it was just like stressful to think about putting her from being home with me during the day while I was in school at night to putting her in childcare. And so my husband was like, why don't you like get your doula certification? I was like, well, I'm not like a crunchy home birthy mom. So like, why would I get my doula certification? Like I still had that bias of just thinking that that was
Right.
what doulas were for. And that wasn't like me and what I jived with just personally as a mom. And so I kind of started to do some research just into like the history of doula care and like what doulas actually do instead of just thinking of like my perception of doula care and some of the statistics behind like how they improve birth outcomes. And when I was kind of doing that, I realized like how much what I wanted to do in life, which was support pregnant and growing families was actually doula support. So I got my certification just kind of for fun, to kind of bide time between figuring out what was happening with childcare and like if I wanted to, you know, go get another job or like, you know, what I was going to do after graduating. And so then I kind of just fell in love with it, and I kind of wrote up my business model, which gives 10% back to the community so that I can take lower income clients as well. And decided I was just going to jump into it and see if I was successful. And it was. So here I am.
I feel like we probably talked about this. Oh, sorry.
Oh, sorry.
Go ahead. Similar story. So.
I know, that's exactly what I was about to say. I was like, I feel like we probably talked about this when we first met, but it was just, it's, yeah, funny hearing it again now that we're a few years out from our initial days.
Yeah, totally. It was a wild time to start a business back.
Oh yeah, with like a baby and pandemic, and when I tell people about it, I'm like, yeah, I don't know if it's what I would recommend, but it worked out. So
yeah, here we are. So
amazing.
Totally.
So you primarily do hospital births. What typically does like a doula do in the hospital setting with their parent or their clients?
Totally. So I like, now that I support hospital births, I don't know why doulas aren't such a more integral part of like medically complex birth experiences. Because honestly, with like my lower intervention clients, I find that I end up doing a lot less than the higher intervention birth experiences. So like low intervention, I always say like the easy part of doula care is doing hip squeezes. Like that's the easy part of doula work. It's just like doing hip squeezes, helping them manage like the pain and helping them get through like an uncomplicated low intervention birth is pretty easy. Where everything gets very complex is when there are medical interventions at play, whether you need them or you want them. So you need an induction. There's a lot of factors to an induction. There's all different types of induction. There's all different medications. There's all different types of monitoring that go into that. And so a lot of times as a birth doula, of course, like I'm not a medical care provider, but I help them navigate that medical care environment and get the most out of their medical care. So knowing what options are available to them so that they even know like what they can ask for. Because a lot of times, you know, it's not that OBs or midwives have a bad intentions at all. It's just that they're extremely busy and have small amounts of time with each patient, and so they will recommend their preferred line of care, but that doesn't mean that there isn't 3 other options that are also great, safe options that might align better with my clients' birth preferences, past histories, birth plans, things like that. And so letting them know what options are available so that they can ask their medical care provider about those options, get their medical care provider's opinion on those options, and then choose the best care plan that's right for what they're envisioning or wanting for their birth, instead of just kind of the care provider's preferences, if that makes sense. I wish that there was a lot that was black and white about birth, but there's just so much gray area of, you know, oh, statistically this might carry a higher risk, but it's a 0.0001% higher risk, and so this other option that you really are more inclined to is absolutely like a safe, feasible option for you to pursue. Type of thing. So helping them know what questions to ask, what options are available to them. A lot of times I find just explaining what's happening around them is very productive, not only for the person giving birth, but their partner as well. Just explaining like what the monitors mean, what the charts mean, like what they're talking about. Because I think sometimes medical care providers are so immersed in the world that they forget that this is all new information, first time experiences for people. So just explaining those things to them, as well as helping them work around medical intervention. So say like they need continuous monitoring because they're a high risk pregnancy, helping them know what positions are available for them, why hooked up to the monitors, different ways that we can still, you know, try to progress labor along, keep them comfortable while working around those medical interventions. Same thing as like with an epidural. Like epidurals are great. We need to keep moving while we have an epidural. And so helping them with positioning, fetal positioning, stuff like that, as well as advocacy work. So keeping them in the driver's seat of their birth experience. Sometimes when a lot of medical interventions are happening to them, they feel very out of control of the experience. And so making sure that when the doctor and nurse are talking over on like the side of them, just about them, that like they're redirecting that conversation back to the person who's actually giving birth, and helping them feel like they're in control. Same thing with like an epidural, like during the pushing phase, making sure they're not just touching them willy-nilly because they're numb, but they're asking for consent around touch and procedures and stuff. Just because they can't feel it doesn't mean that's not something that's happening to their body, and they don't need to ask that person for consent. So some advocacy work around those medical procedures. Low intervention, again, a little bit less complicated, but a lot of advocacy work to keep them low intervention and to keep, you know, hospital staff not just suggesting things to make it, you know, to push things along, make things faster and easier and stuff like that. Making sure that they kind of have that like bubble of protection over them to keep in that like proper mindset during if they're wanting an unmedicated birth.
Yeah. I mean, I feel like so much of what you're talking about is like just have the information available in your brain to then have them access to. And we know so much about like how trauma is felt when you're overwhelmed. So like you kind of being there to like keep that overwhelm at bay, because even though, you know, like you said, it's unknown things are going to happen. Be able to have that person there who's like there for them to keep their brain, body, self from getting into that overwhelmed category and like moving into that, like this could become a traumatic memory, you know, and you know, traumatic things are happening. I feel like what you're saying is like that middle person to be like, let's keep it under, you know, like under that level.
And a lot of times, so when like we look at birth trauma, a lot of times has nothing to do with what interventions you needed or accepted. It has to do with that feeling of being out of control of your circumstances. And so making sure that even if they're planning the most low risk unmedicated birth and they ended up needing a 37-week induction for preeclampsia and everything went out the window, they're informed about everything that's happening to them and feel like they can make the choices that they can make in that situation and have the power to do so. As well as, you know, a lot of people go into birth nowadays, unfortunately, I'm sure you guys see all the time, with a sexual assault history, with past trauma. And something that's so great about doula care is that we have the time to get to know our clients before the birth. We don't have to know like the nitty gritty of everything they've been through in life, but knowing, hey, this is important to me that nobody is touching me without my consent. This is important. Like I don't think I can be in stirrups on my back when I'm pushing. I think that would be triggering for me. And then them not having to relive that trauma to all the medical professionals during that birth, because I wish trauma-informed care was like across the board a standard, but unfortunately it's not unless you tell them. Unless you tell them, I have this past history of trauma, it is not something that is just across the board going to be practiced. And I don't want my clients to have to go into their birth and tell all the medical care professionals like, hey, I experienced sexual assault in college. Like that's not something you should have to be talking about on the day you give birth. And so just making sure that like I can be the one who knows that they have these certain things that they think are going to be triggering to them, and then be able to advocate for those with the medical care professionals so that they're not having to have those conversations on the day of their birth is also extremely, an integral part of what we do to keep that bubble safe.
Totally.
And you may not even realize like what is going to be triggering, but it's nice to be able to talk through like in the moment with someone. I feel like that's something that a lot of times our patients, we can help like say like, hey, this might, based on your history, like this might be things that are, harder, and I think people are just like kind of shocked by that. I don't know. Especially if you've never been in a hospital setting before,
Absolutely. Yeah. Cause I have a lot of, people with past trauma who will say like, well, I think since I know like it's a medical environment that I know everybody there is like keeping me safe, that I'm going to be like, fine. But then like, once we're actually in that experience, I can see it on their face that they're starting to like clam up. And so just knowing that that's something, and then being able to be looking out for that. And then like in that moment, instead of having to be like, hey, are you traumatized right now? Being able to be like, hey, do you want to try this other position for pushing? And like me being kind of like not the bad guy, but like the person that's changing the situation instead of them having to speak up, because we call it the fawn response in birth. It's very easy when you're laying in a bed, a bunch of people standing over you who you might not even consciously perceive are an authoritative figure over you, but subconsciously your body is feeling very vulnerable in the moment of birth. And it's very easy. I see like the most opinionated, strong, powerful women who are like, I'm gonna be able to advocate, I'm gonna be able to say what I want to say during birth, just like clam up in that experience, because your body goes into that like, I need to behave, quote unquote, because these people are in like I'm in a vulnerable position and these people can do harm to me if I don't. Which is it the reality? No, not usually, but in that experience, that's how we are perceiving it as a person. And sometimes you need a doula or a partner to be able to stand up and advocate for you in those moments.
Yeah. So you talked about how for your birth, your husband was like really integral as that partner. Mm-hmm. How do you kind of help, like, what do you now take and help those partners, help their, help the safety, help the advocacy, help the pain management, all that kind of thing? What does that look like for you?
Absolutely. Absolutely. So I will say, like, there is, looking back, I have very easy birth experiences. And so I'm very grateful. Like, my husband was there to help me. If I had more complicated birth experiences, would he be able to step into that role in the same effective way? No. So there are benefits to having a doula outside of having partner support. But I just like to always state that, because I'm always like, my partner was like amazing birth support for me, but also I had 6-hour uncomplicated deliveries for both vaginal births for both my kids. So it was like very simple, straightforward kind of birth. But there is actually statistically a lot a benefit to having your partner who takes some kind of doula education and support you. There is like a statistical difference in like birth outcomes. And so my husband personally, like, I've just made him attend all the childbirth classes, watch videos online. And then The Birth Partner is such an amazing book. I don't know if you guys have ever heard of that book before, but it really kind of, it gives very just like straightforward information about kind of all of the things that happen during birth, like the complications that can arise, as well as just all the standard like procedures and stuff, and kind of like the pros and cons of them. It gives a lot of just like basic information on birth support, like pain relief, positioning, stuff like that. I made him study that book, and he did a really good job with it. So yeah, really preparing. And I do have to say something that I feel like my husband just generally stepped into, but I think a lot of partners need to train more for, is like non-confrontational advocacy techniques. So speaking up for the person who is giving birth, because again, like I just said, I'm the more opinionated person in my relationship. Like, my husband's a quieter person. I'm more the person who does not have a problem stating my feelings or my intentions. It might be I'm from the Northeast, so I'm a little bit more blunt. He's not. He's a Midwestern, so he's a little bit more like the kind, not one ruffle feathers kind of person. But learning some non-confrontational advocacy techniques, like knowing how to work through brain, like benefits, risk, alternatives, intuition, what happens if we do nothing, that kind of, I don't know, you guys have most likely heard BRAIN before, the BRAIN acronym before, of how to work through like things that are being offered to you and know what questions to ask, knowing that you could ask what happens if we wait, just knowing what options are available and being able to ask for those things, as well as being able to make the person who's giving birth's voice louder. Because maybe like when the nurse walks out of the room, she's like, your partner might be like, oh, I really don't like these monitors. I really wish I get wireless monitoring, but I don't want to like bother them. Then being the one to be like, no, we're going to bother them. We're going to ask for these things that you're wanting. Oh, you want to get in the tub, but they keep giving us the runaround around, oh, well, we would have to go find this and that to get you in the tub, being like, okay, well, like, we're going to make that happen, kind of being like the pushy, not in like a confrontational way, but just like a little bit of that pushier person to like make sure things are happening. As well as just being the one to like, I know my husband with both my births was the one to bring the birth plan like to the nurse and the doctors who were attending the birth, and being like, running it through with them and talking them through it, and like making sure they knew at each different stage of labor like what my birth plan was, is like so integral too, because you during birth need to stay in that labor brain and in that more like primal brain, and every time you're getting pulled out of it is just like unproductive to the birth experience. So there are so many things, you know, partners can do to prepare. Like I said, reading books, listening to podcasts, just knowing that it's not just your wife, girlfriend, partner's job to be the one preparing for birth. It's an integral thing that you are also well prepared for the birth experience going into it, and know what your partner's preferences are.
Yeah. Yeah. Both. And this is when you come together and do it together. Yeah.
Yes, absolutely.
Do you have any like stories to help people understand like the importance of that partner being an advocate for the birthing person? Like, is there a specific example that you've kind of seen? I mean, you've given a couple of like, you know, making their voice louder, but I don't know.
Yeah. So I'll give an example from one of my births. But also I just like to say, I find that even if you have a doula, nursing and hospital staff tend to listen to partners a lot more, like over a doula, because they see them more as like connected. They are connected to the patient. They are part of the client to them, you know, of kind of like the partner and the birthing person. And so I do find, you know, of course, I have great relationships with a lot of the people, like hospital staff in Kansas City, but still sometimes there's like this perceived kind of like rift sometimes between OBs, nurses, and doulas. And so I will be the first person to like, I don't care if they're going to be annoyed at me, like I'm going to ask. But I find that when birth partners advocate for the person giving birth, there tends to be a lot more of like a rush to listen to them and a lot more like receptiveness. So I think that that's like an important part also, that even if you're getting a doula, it's important to like include your partner in that in those discussions. And so my second birth was a precipitous birth. So it was an hour and a half from start to finish. So very, very fast. When you experience a birth that fast, you are like in a completely different world. Like you are not in world at all. And so I was very insistent, due to not my own trauma, but from secondhand trauma as a birth doula, that nobody touched me while I was pushing. Like, because I've just seen very aggressive perineal stretching and aggression towards like pulling on the baby and just stuff that like I knew, because I trust my care provider. Like I obviously have the pick of the litter. I know all the birth providers in the area. And so I trusted my care provider, but just I knew that from what I've seen in birth, that like if somebody was touching me while I was pushing, it would distract me and would kind of like like make me clam up. And so, but my birth was so fast, I had no moment to like discuss with the person who was on call, who wasn't my midwife. It was a different OB/GYN who works for her, discuss what I wanted, anything like that. Actually, the OB didn't even end up making it to the delivery. The resident ended up catching my baby. So anyways, I had no time to discuss any of that with them. But my husband knew that was important to me. And even in like the rush of, I think I pushed like twice, like it was like oh my gosh, he's crowning, okay, resident better catch him. But I was like, he was like, nobody touch her, like nobody touch her perineum. She has it on the birth plan. I don't want, you know, she doesn't want that. I didn't even realize that he said that. And I wanted to catch my baby too if I had the option. And so they were just like, okay, reach down and catch your baby. And like, that's all the coaching that happened during pushing. And so it was so funny because after I was like, wow, that's crazy. Like everybody just followed what I wanted my birth to exactly look like. He was like, I was telling them to do that. I was like, well, good job. Because I did not realize at all in the fog of everything. But how important that is, that like me being a doula, knowing how to advocate for myself, knowing what my birth plan is, had an unforeseen circumstance if it wasn't my provider on call, because my provider was going to come in no matter when I gave birth, like even if she wasn't on call. But since it went so fast, it wasn't like I didn't get to call in my provider. Nothing was able to be communicated at all. And he was able to communicate even in that rush moment, like exactly what I wanted. And then it ended up being like my perfect birth experience in the end.
Oh my gosh, that is amazing. We love that.
Yeah. And sometimes knowing the why, like for partners, not to know just the birth plan, but the why behind the birth plan. Because it's very easy when medical staff starts then bringing up, well, this is why we do it the other way, that it's hard. Like, and I try to tell people all the time, you don't have to explain to the nurses or the doctors why you want it a certain way. Like they have their policies, procedures, and the way that they were taught how to do things. It's totally viable as long as it's safe, obviously, and you can ask that question, like, is there a safety risk with this, with this option or something? It's totally reasonable to want individualized care, to not want it to happen exactly how they do it for every single person. That's a completely reasonable thing to ask for during your birth experience. It's a lot different than I think people think of it a lot of times as like a medical event, like a surgery or something. And like, you're not going to tell your surgeon how to like first do an appendectomy, like before you go in for an appendectomy kind of thing. It's very different in the sense that birth is inherently a physiological just event that our body goes through. But there are medical things that can help keep it safer and also keep it more comfortable. But that doesn't mean that there is like one right way to give birth, and you're more than welcome to ask for different things. And so you don't need to explain to nurses and doctors why you want it a certain way. You can just say, no, I don't want perineal massage. And then they might say, well, we think that it decreases the risk of tearing. Well, okay, I just don't want it. Like, I don't have to explain to you that I have past trauma, or I have this past experience, or I learned this thing from my pelvic floor PT that's a better way to reduce the risk of tearing, that I'm more comfortable with. You don't have to explain. You can just say, no, thank you.
Right. Yeah. Are there things that you find specifically are like really common things that people are having to advocate for within a hospital setting? Obviously, like there's a million things that could happen within a birth, but are there like trends, I guess, within what people are regularly needing to like have individualized care for?
Yeah. So the two biggest ones that I see are breaking your water. A lot of providers, once you're admitted to the hospital, just offer to break your water. They're like, well, you're here, so we might as well break your water and like speed things up. And I find that pretty consistent across a lot of the hospitals in the area. There's no reason like why your water needs to be broken. Like it does speed things up, but there's no like medical reason why your water needs to be ruptured when you get to the hospital or at a certain point in labor. I've seen babies born in call, which is like when they're born in their amniotic sacs and their water never breaks. So like there's not like a medical reason why it needs to happen, but I find that a lot of people get really hung up on the fact that their provider is suggesting it, and so they just think, oh my gosh, I need to get my water broken, like for whatever reason. And so that's a great time to ask, like, why? What are the benefits? What are the risks of getting my water broken? Because there are risks to getting your water broken. And some of it makes things more intense. It increases your risk of infection. It can bring the baby down in kind of a weird position. Sometimes they don't like the water being broken because it kind of like makes them lay on their cord weird when they get brought down or something. But there are also benefits of sometimes some interventions can lead us to a lower intervention birth. Like I just had a client who wanted a medicated birth, had been in labor for 40 hours, and she was still 7 centimeters, but baby was super low and applied. And I was like, if you get she was like, do I get an epidural or do I get my water broken? And I was like, which one's more important to you? And she was like, I don't want to get an epidural. And I was like, well, if you get your water broken, that's probably going to speed things up. And then you'll be more likely to be able to have an unmedicated birth before you reach maternal exhaustion. And ended up, she had the baby like less than an hour after she ended up getting her water broken. So that's like, it's not that getting your water broken is a bad thing, but it's just that it doesn't need to be like something that you have to routinely accept just because you show up at the hospital and your water is still intact. Another thing very commonly, which I'm sure you guys are heavily involved in or like knowledgeable about, is pushing. So we find that, I was just at the Integrative Obstetrical Conference here in Kansas City, and me and some of the doulas were talking about how pushing is when medical staff get the pushiest. So I don't really understand why, because like the evidence doesn't support it. I think it's just kind of like the last thing to kind of get brought more into patient autonomy. But like during laboring, they'll be like, we need to do all these positions and all these things, and be like super into that, like labor nurses and OBs. And then when it comes to pushing, they're like, you need to be on your back with the stirrups. This is how it needs to be done. And then they find like every excuse in the book to keep them in that position of like, we'll be like, oh, we need to do this, or we need to like, let's try this position, let's try that position. Oh, I need to do a cervical check. Oh, I need to see where baby is. Oh, I can't really see. Can you get on your back so that I can like kind of see where baby is? Then it's like, oh, well, you're here. Do you want me to put the stirrups up to support your legs so that you're more comfortable? Like, it's like all these little like pushy things. Or I've even seen, I see a lot of times nurses break down the bed when they're 10 centimeters and they're going to start pushing. They break down the bed so that they don't have anywhere to put their legs other than on the stirrups. And then it's like they'll do it without even asking. Like they'll just put their legs in the stirrups and break down the bed without even asking. And so then if like we're pushing on our back for a while and it's not going great, then it's like okay, you need to put the bed back together so we can get these. Like it's just more things that then you're like, people feel more uncomfortable asking for things because then it's like more things have to happen in order for them to get what they're wanting. And so that is a great place to know, like for partners to know what are hospital policies and procedures so that when they start to see, and what's going to happen, so that when they start to see them starting to break down the bed, they're like, oh, we don't want that. We want freedom of movement and to have the bed intact so that we have more places to move. Let's stop that right now instead of having to be like reverse everything after it happens, because that's a lot more difficult to reverse than to just not have it happen in the first place. I've even seen so much as like, I've actually heard this multiple times, nurses saying, well, if we don't break down the bed, there's nowhere for the baby to go when they're coming out of your vagina. And I'm like, okay, so explain that to all the births that I've seen where the bed never gets broken down and people are on, like nobody sits on their baby's head. Like there's, that would not be comfortable as you're pushing. I promise you, I've seen so many doctors deliver babies without the bed broken down. Promise you it works out. So anyways,
you can do it.
Yes. Let alone, and then you wonder, at those hospitals, let alone how many births are they seeing that aren't on their back, right? Like how many, like if that's to the point of like manipulation that they're going to keep people on their backs, pushing, of saying there's no way you can give birth not with the bed broken down with your feet in the stirrups because the baby can't like be maneuvered out of you that way. How much are they then against doing all fours or, or squatting or other positions? I've also heard many times squatting at one particular hospital that it puts your pelvis at a right angle so the baby can't come out. And I'm like, and then when we go on their back, they go, pull your legs up like you're squatting. So those are the things, and you might think this is ridiculous, but I see this at very popular hospitals to give birth at, and I've heard it multiple times. So things that nurses were just trained and OBs were trained by older providers, they kind of want to do it that way because it's the easiest for them, and so they kind of like make up reasons why that is the easiest way to give birth, and then they're repeating it so much that it just becomes their truth because they're not like doulas and like you guys who are hearing stories from people giving birth at all different hospitals and home births and birth center births and all this stuff. They don't see the wide variety. They're only seeing what their hospital says and does as their kind of common procedures. And so, yes, it's very different. It's very interesting when I'm at one of those hospitals and I get like a travel nurse or something because they're always like, this hospital is like weird. Like, why do they say this or like do this stuff like this? Why do the doctors always say that like this is how it works? Like, that's a great question. And so just knowing like you're not probably going to change the mind of people who are trained for years and years and years to practice a certain way. You don't need to. You just need to say, it's my body and I'm going to do this. And you guys can deal with it or not, kind of thing. And so really knowing, because what I see a lot of times is people doing all the great prenatal work of getting the education, seeing pelvic floor PTs and learning all the different positions to push in and how to prevent tearing and stuff. And then that not translating in the hospital setting because people are giving them pushback and they don't know how to just do the advocacy work to say, no, I'm not doing that. Or I don't care. I understand that you think that's the best way, but that's just not what's going to work for me today, And so really being able to just stand up for themselves and say, it's okay. I'm just not going to do it that way.
Yeah. I feel
and
like
not having to give an explanation.
A lot of times with patients, I'm just like, smile and nod and then do your own thing. Okay. And then don't put your knees in your armpits.
Yeah.
I don't know. Yeah. It's just really confusing to me that like there can be so much literature, so many examples of better outcomes. And I'm like, why are we holding on to something so hard when that's like not true of medicine almost anywhere else? But for whatever reason, there's this like nostalgic picture of what it should be to be in a birthing position. I don't know. And it just is odd to me that it's like held on with like white knuckles by providers. I'm like, it really isn't that much easier for you if you're dealing with like an extended pushing period because they're in the wrong position, or they're having to have massive tearing, stitches, recovery postpartum. Like that's not easier. I don't understand.
Yeah, and I find that a lot of the disconnect comes from OBs like don't labor with people or push with people. So they don't see, like they come in when baby's crowning. So they don't see how hard it was for them to get there and how strenuous that was. And so I'm seeing a lot more change in nursing of like a lot more nurses, especially I think with the influx of social media, because nurses are, especially the younger nurses, are seeing people saying, we're not happy with this, you know, people who are giving birth, because maybe they didn't feel comfortable saying that to their nurse in labor and delivery room, but then after they're like reflecting on their birth experience thinking that was crappy, I didn't like that, and so then they're going to social media to say that. But a lot of times nurses are getting this overhead pressure from doctors, and I find that like I will work with nurses for different births, and it'll depend on who the doctor is, how pushy they are or not around certain procedures, because they're afraid of getting, like they're going to get in trouble or backlash from the doctor, the provider, if the provider has certain ways that they kind of do things. But to that, I'd like to say, providers, you are doctors. How difficult is it to catch a baby on all fours versus on their back? You can't, you learn one thing. Like I understand you're busy people, you do surgeries, you do gynecology, you do birth. I understand it's busy, but it's learn it. Just learn it, because it can make or break somebody's birth experience.
Jen Hamilton, who's like, I believe in you. You got this.
Yes.
I was like dying the first time I heard her say that, when she just like looked at the doctor and was like, I believe in you. You can do it. And I'm like, right, it's not hard. Like you can, like you're a skilled medical provider. You can learn that it's the same.
I think something that's so great about like how Jen Hamilton talks on social media and stuff is that I think, you know, I'm not a nurse, so I'm not in this world, but what I think is a good benefit of like doulas over nurses is that we're only hired by you. The nurses and the doctors are not our boss. So like, of course, do I have relationships with doctors in the community and they give me referrals and stuff? Yes. Not enough so that I'm not willing to like ruffle some feathers. And I find that I have some doctors that like, they refer me all the time. And there's a few times that I've been like, you got this. You could, you know, or like they'll say, we're going to do this. And I'm like, no, she doesn't want that. You know, like she said she didn't want that. Did you hear her? You know? And so, you know, I think that I wish that more nurses were empowered to stand up to, not necessarily stand up, but advocate for their patients to providers. Because most of the time they're hired by the hospital. They're not actually hired by the doctors. And so, you know, getting that positive patient feedback could help you keep your job, even if a doctor doesn't like you. So anyways, but I think there is that perceived hierarchy and power dynamic that is difficult to kind of do away with in a hospital setting, as well as hospitals have the legality side, right? They have the liability of I kind of have a professional relationship with like a birth injury lawyer, and she, you know, I learned also in my doula training that when doctors are being sued for something, they don't have to, it's not the what is like research-based practice is what it's common practice that they were put up against. So like when other OBs come on to testify whether what they did was like typical or common or like normal practice or not, it's not up against, they're not being pushed, you know, put against evidence, like research. They're being put against what other OBs in their field do. And so there's like that liability factor of if you do things against what is like commonplace. That was why it kind of takes a long time for things to change, because it has to become kind of like common practice for the less risky OBs, the ones that don't have, you know, a higher risk tolerance, to adopt it. But a way that you can get around that as a patient is just saying no thank you, because then they can just chart that you refuse. And so if there ever was some sort of lawsuit or something like that, again, like, you know, ask if it's safe, you know, all those, you know, gather the information. I'm not saying that you should just be like, no, I'm going to buck everything that my doctor wants to do because I just want to, you know, I'm not saying that they don't have great insight into what is like safe procedures and not. But lots of times they don't really have like a reason. They're not like, oh, this option's way more risky. It's just that they're more comfortable doing the one option because it's like their common practice. And so if you're sure that you want to birth on all fours, and maybe your provider isn't as comfortable with that because they're like, if something goes wrong, you won't be in the ideal position for me to intervene, or we might have to wait 20 seconds to get you on your back before I can intervene, and a shoulder dystocia or something like that. You can kind of just be like, no, I'm refusing that. You can chart my refusal. You know, little things like that is totally okay.
Yeah. Well, and things will never become common practice if we keep not advocating for them to be required to do the new best practice thing.
Exactly. Yes. And I try to tell clients that too, of like, you're giving them, like, you're doing things to make birth. Like if you want to birth on all fours, that's like something then that people are going to see in the room, and it's going to become more normal the more that we do it. I actually had my midwife, which I gave birth at a hospital-based midwifery group. And so they do a lot more, like, you know, more physiological birth and stuff. But she even said, she was like, if you give birth on all fours, will you let me call in all the medical students to see you? And I was like, yeah, sure. Like, I literally don't care at all as a doula. I'm like, that would be great. And ended up being the resident who got to catch my baby, and I wasn't on my back. So anyways, I was just like, yeah. And so they were like, oh my gosh, she's gonna be talking about this for like a week. She was so excited that she got to catch a baby and everything. And so just letting that be seen. And I'm not saying that you have to like let all the medical students in if you're not comfortable with that, but just like being able to advocate for yourself, it is advocacy work in and of itself in the hospital setting.
Yeah.
It's a really cool way of looking at it.
Yeah.
Okay, this just a tiny bit of a change of topic. Sorry, Rach, did you have another? Okay.
No.
But kind of on the same line. So for like birth partners, I hear a lot of patients say that like, oh, I don't really know if I need a doula. Like my husband is super supportive. Sorry. Loud truck. Sorry. My husband is super supportive, and like I don't really know. And I know what I say to them in that situation. And I always advocate for doulas because I just think that I had a scheduled C-section, but my daughter had medical issues, and I wish I had had a doula just to have someone with me. So I'm like, I always recommend it. But anyway, I guess I'm just thinking about like birth partners are great. And even if they do all the research and everything, and obviously you are a doula, so that helps because you're advocating for yourself. But what do you say, or like, how do you tell people like that? Well, this is like the difference in like my role versus like, because I always think the birth partner is also kind of a patient in a way.
Yeah. So it's like their birth experience too, right? If it's like the day that they're meeting their baby, and that's like overwhelming. And also like you want to be able to be more like emotionally involved in the process instead of always having to think about like logistics and advocacy. So of course, you know, I know it's a privilege to get a birth doula, but you know, I think that there are huge benefits, even if you have a supportive partner. One is birth prep. So like being able to help prep your partner for the birth experience. Doulas know birth, your partner knows you. So I find partners have really great insight into like, usually when she's in pain or sick, she doesn't like to be touched. So what are some ways we can still help with comfort if she's not wanting a lot of touch? Other partners are like, oh, she loves just like affirmations and massage and like all, you know, is like a more like lovey person and will want to be like touched all the time and get, you know, told affirming words and all that stuff. So it's great for doulas to have that insight, but also you most likely either never experienced birth, or maybe if you have another baby once or twice, have experienced the birth environment. And so we know all the different, we know the birth world, we know the monitoring options and the intervention options, and what's happening when nurses are saying this, what do they really mean? Like what's about to happen when the nurse says this or that, or the doctor says this or that, that we can disseminate that information. As well as we are support people for the partner as well. We are for the partner and for you. Not only can we help them ease their anxiety by explaining what's happening and helping them with those things, but we also can give them breaks. Like if they need to go to the bathroom or get something to eat during a long birth, like we can give them breaks. We can help coach them on how to be effective partners and help them be like an involved person during the birth. I actually just had a client who it was her second birth, and she didn't have a doula for the first, and then she did have a doula for the second, and because she didn't have a great experience the first, and she felt like a lot of things were just happening to her, and she didn't have a lot of ability to advocate for herself. Her husband actually after her second birth told her, like, that was such a better birth experience for me. Like I felt like I knew what to do to help you. Where like the first birth, I just kind of sat on the couch and was like, I don't know what to do or how to help. Like you guys, like you and the nurse just kind of got it. Like I'm here, I'm excited, but I don't really know what to do. Versus the second birth, I was like, help her get in this position. Why don't you do this comfort measure? Oh, she wants to get in the shower. Why don't you like go in with her? Like here, I'll put a chair in there for you, and you can like talk to her while she's in the shower, and I'll just like close the door, and you guys can like have some alone time and kind of just like bond and talk about the baby and be excited while she's like showering and getting more comfortable, and kind of like increasing that oxytocin, right? Of like that comes from your partner, not from like your doula, of like all that like comfort. Like you're wanting it more from, most likely you want it more from your partner, your husband, whoever's supporting you in your birth, than like your doula who you've only met a couple times. And so me knowing you guys as a couple and being able to help you help your partner, the person giving birth, more effectively, usually leaves partners feeling empowered throughout the birth experience. They felt like they were a key component of the birth experience, and were able to really like be a part of it. And you know what? Having an empowering birth experience translates very positively into having like starting your parenting journey on the right foot. If you leave your birth being like, wow, my husband didn't know what to do, I felt so alone, I didn't feel like he knew how to help me, and then your husband's like, wow, I felt so inadequate, that was so scary, like all those things that happen, that starts your parenting journey off on like a negative note, and where you're not feeling like connected and safe with each other, and like like you're feeling empowered. I really feel like ideally for my two great like positive birth experiences, I had very positive birth experience, and I feel like that helped me so much in my confidence, especially as a first-time mom. Like when you're a first-time mom, everybody kind of questions you and makes you like doubt a lot of your parenting choices, and standing up for myself and like advocating for and educating myself and finding the right birth team, and then like making my birth happen, even though it had like a few little sideways things that didn't go according to plan, but like I always felt empowered and in control during the whole experience, made me feel so much more confident when I started my parenting journey, being like, wow, I already had stepped into that parenting role during my pregnancy and my birth. I stepped into that role of figuring out what was best for me and my baby, and making the choices and advocating for myself to have that. It left me feeling so much more empowered, that then when, you get all the first time mom comments like, you should sleep train, not that sleep train is bad, but just like, you should do this, you should do that, you should give her a bottle of formula, like things that weren't like what I wanted to do as a parent, being like, no, like I'm fine. I'm fine making these choices for myself and for my baby. Not that you shouldn't take advice, but just like standing up for what you're wanting to do. Kind of gave me good practice for that, for when it came to parenting and advocating for my child and stuff.
Yeah. And that's true of partner too. Yeah.
Absolutely. Yeah.
You never know, especially first time, you never know exactly what your partner's going to do. I had a friend who, her husband like is an extreme athlete, like triathlete, Ironman, passed out.
Oh goodness.
Like never had to have a sticky note in the chart, because like for her husband, for their like births afterwards, he had to have his own like nurse, because But this is like you never know. Like you're expecting your incredible husband to be there for you, and he's gone.
Absolutely. And like, but it's like he's never experienced birth. He didn't know what to expect. I actually recommend a lot of dads to watch like a live birth, especially my ones who are more queasy, being like, you should just watch like one live birth so that you just have an idea of like what it looks like, because there's a lot of other things other than just what it looks like you hear your partner screaming and you're worried about them. There's 1,000 doctors in the room, there's smells, there's like everything that it can be like a lot sensory wise during the experience. And so having like some idea of like the sounds your partner might be making or what it looks like for like a head to crown or a baby to come out via C-section is great.
Yeah. Yep.
Mm-hmm.
So many good points. I mean, just so I love that, like I just love that, like leading positive birth experience, positive like beginning of parenting journey. It's so true. And I mean, yeah, so great. Such a good, like another good thing to just like remember, and another good, I don't know. Just like everyone wants to start that off right. And you kind of think of this like birth as just like one moment or like one day. And it's just so much more than that. A lot of times.
Well, it's one day that's going to stay with you forever, right? I would say even more so than like my birthdays are so much bigger to me than my wedding days. And like how much time and preparation and money did I put into my wedding day, which is like to kind of start your marriage off on like a great, like a big day to start your marriage off on like a great kind of note, and have these people like around you supporting you through the experience. How much more so is birth that of like it might just be one day or a few hours or 2 days or whatever, but it's like it's a day that you're going to remember for the rest of your life. And no offense to all my clients, but like I don't remember every single one of my clients' births and the details, and I promise you the nurse and the doctors are not going to like hold this permanent chip on their shoulder because you asked for something different than what they suggested. To them, it's just another day of work. And I hate to say that to people, but it really is just another day of work to us. Is it a big job of being like, wow, this is a really important day for the people that we're working with, and it's such a big moment for them. Like, yes, that's not lost on me, but there is so much more room for your preferences to be honored, because it will be one of the biggest days of your life. You might experience it 1, 2, maybe 3 times in your life, and it's an important day for you, and that shouldn't be lost on you in preparing for the birth.
Yeah. Yep.
So cool. Well, thank you so much, Heidi. I think this
no problem.
I just love always talking to you. I always learn something. So thanks for sharing with our audience. And yeah, is there anything, any last thoughts, recommendations, things you're doing a course for doulas right now, right?
Yeah. So I have a course that I just launched for doulas. So if you're a doula listening to this and you want to learn more about supporting people in a hospital setting, you can find that on my website, on my social media, all around there. You can follow my social media. I think I mentioned in the beginning at WhataDoulaDo on TikTok or Instagram. And then on Instagram, we also have like our work page, which is the birth block, block with just a C. And so, yeah, feel free to follow us over there, and always feel free to DM me and connect if you are somebody who has any questions about what I was talking about.
Yeah.
Thank you so much.
Yeah. Thanks for having me, you guys.
Yeah. All right.